the message is talk with your patients, that you will learn a lot also.
Fellow Homo sapiens, we have in this week's Epilepsy Sparks Insights podcast, adult neurologist Abril Marone from Buenos Aires in Argentina, telling us about her cool conversations with patients who are transferring from pediatric to adult care, including topics such as sex and sexuality. I'm really so glad that we have clinicians like Avril feeling able to talk about things like this, as they are a key part of a person's life.
Hi everyone, I'm Abril Marone. I am from Buenos Aires, Argentina. I am an adult epileptologist. I work at Fleni Institution in Buenos Aires also. I am also a visual artist. I love arts. I am really enthusiastic about that. I love epilepsy because it's like there's a lot of things we don't know about it, and we can also investigate and get to know more and more. And that's why I studied epilepsy.
You know what, everyone? I will put the link to Abril's arty website on our website, so check it out. But anyway, so back to your work in the epilepsies. I would love for you to tell us about your work that's been done through ILAES, Young Epilepsy Section, and when it comes to the work between pediatric and adult care in epileptology. Could you tell us about that, please?
In our group of YES Argentina, we work on this topic between the transition between pediatric patients into adult patients, and we saw that there were lots of things that were missing in the middle, maybe some information between the pediatric doctor and the adult neurologist, and we tried to make two things, maybe like a record and a clinical record that has lots of things written about the person, not only the epilepsy information, but also mental health issues, the social part, the things that like the patient, things that they do, and we made this like a clinical record, like it's based in these things, in order that the pediatric doctor completed it to the adult neurologist.
Like a CV or resume from one section to the other section.
Exactly. And this is the first step we made. And then we tried to make the transition to be slow and not to be like something dramatic from this type of attention to that type of attention.
It's quite a stressful time, isn't it?
Yes, because you change from the doctor that have seen you maybe for 10 years or 15 years to a new one. So it was really traumatic for the patients, but also for the parents. So we, in my institution, we developed this thing that for 1 year, we alternate consultations between pediatric neurologists and adult neurologists, with the parents and the patients. And what I personally do in my place is like I let the young adults come in first to talk with us, with me, about the things, to talk about the epilepsy, but also about the things he or she likes, or the things that they are worried about, or maybe things that they don't want to talk with their parents present.
So no parents in this session, it's one-on-one.
Yes, and then I make the parents enter to the session, and we talk about medication or some things that the patient might not know because of the seizures, I don't know, something like that. And I think parents are okay with that. Some parents don't, but some parents are okay with that. And I think it's like a message we have to send to the parents, like, your child now it's a young adult, and from now on what it's important is epilepsy is going to be in his hands or in her hands. So it's important for the young adult to get involved into their own care.
So the things that you would ask the patient, they include things like sexuality, drugs, anything affecting their health. Could you tell us more about that?
Yes, we always make the consultation open to these subjects, because I think it's important for us to be a space of, to be the doctors, to be that space where you can talk about everything you want. So because you have epilepsy and you will have it not always, but in your life. So it's not like these things separated from your daily life. So we have to talk about the things that happens every day. So that's why I always talk about sexuality, sometimes because of the epilepsy, or sometimes because of some medications that they take. And I always warn them, because some of the medication might have some effects, and we usually don't talk about it. And I think it's important to tell them, if something happens to you in when you have sex, and it's new, and you're initiating this medication, you can come here and talk with us about it, in order to change this. Because we what we need to do is to make the patient be comfortable with the medication and with with epilepsy.
They have to have an understanding as well, don't they, of what's ideally, if they're able, of what's going on. So, and so, I mean, I think I wish people had been more open about things like this when, I was going to say when I was growing up. I'm not sure I'll ever grow up, but when things like erectile dysfunction, or
Yes.
vaginal dryness,
Yes.
or struggles to, or orgasm might take longer, or
Yes.
So literally think it can affect you physically, but also I believe it, drugs, and also just knowing you have epilepsy can, affect your physical desire, your sexual desire, and things like that. Are these the type of things that you bring up in conversation?
Yes, these things are not usually, because sometimes we'll have so many times in this consultation, but usually when we make this transition, we take more time with the patient. And yes, I get to talk with these things with the patient, and also even sometimes when the parents are there, because they have to know that they are not children anymore, and they are adult people. So we have to get involved in these things, because it can change the quality of life. Sexuality is a great part of the quality of life,
being human.
Yes, exactly. So why not talking about these things in the consultation? So I think it's really important, and to tell and to give the information to the adults, because sometimes they don't know the name for that dysfunction, and they have I think we have the obligation to talk about these things.
I agree, professional and ethical. Like it is, I think we've come a long way, but no doubt there are differences between what happens, in South America compared to what happens in Europe. But yeah, we are all the same species. You tend to have the same sort of similar desires. And I think it's something, this is my personal belief, it's something that needs to kind of be brought up more. And and also, and this is easy for me to say, but often I think it can be really challenging for parents to even think about their child ever having sex.
Yes.
Oh my God, that wouldn't have. And often, especially I think if they have some degree of intellectual disability, is a presumption that they won't have any desire. Now, I'm not a clinician, and I don't know about each individual person, of course not, but I have no doubt that many, many people who have been living with their mum and dad forever, and for instance, might have intellectual disability as well as other comorbidities and epilepsy, will have sexual desire.
Yes.
And that they need to, be able to communicate about that, or have that. I don't know. You tell me what is done in that situation.
When we have patients with intellectual disability and epilepsy, and we have to, I think we have to talk also about these things with these patients, because they are like us, but they can't communicate the same way as we do. So we have to talk with the parents. We have to know what is going on. Sometimes I told you that I had this conversation about one patient with intellectual disabilities, that he wanted to have children, sorry, and it was really difficult to talk with him about this. And this I talk with a psychologist and a psychiatrist in our institution, and we get to talk with these things with him. and now I think he feels relieved about talking about this thing, because it was an issue that it made him really stressed. So it was really nice to talk about this. He asked us a lot of things, and it was nice for him and for his mother also, that was really happy to see her child talking about these issues. So it's nice. I think they need to have the chance to talk about these things. Here in Argentina, it's a place that it's really, I know they say like psychoanalyzed, I think, because we have a lot of psychologists.
Oh, I didn't know. Okay.
And lots of people go to the psychologist. It's really rare
really?
if you don't. Yes, it's rare if you don't go to the psychologist here. But it's an advantage for us, and for the young people are more open to go to the psychologist than the old people. But I think it's a really advantage for us, because they get to be more aware of the tools they need emotionally to get through these things. So
ask questions as well, to have that space where they might not talk to somebody else because for whatever reason they might not feel comfortable with it, but they can go somewhere and ask a question. And then I think also to have you it's almost like a behind the scene multidisciplinary team. You've got the psychiatrist, and sharing that information, obviously legally and ethically, right, about the person to give them the best care and the right answers as well, whatever works for them. I think that's really cool. And I love your openness also about therapies, and I think we need to get more like that in Europe, but that's just my opinion.
Yes, I think that's for example in my practice, I see that when they go to the psychologist and they get that tools, emotionally they grow a lot, and I see that in my patients. So I think it's really nice for them to get to that therapy. Yes, so they don't have this taboo or this thing that they say, if I go to a psychologist I am mad. It's not like that. Here they are very open to this therapy, so I think it's an advantage for us.
Definitely, since there's such a high rate of mental illnesses amongst the people with an epilepsy, it's absolutely crucial to get that sorted out.
Yes,
and also, as we were talking about before recording, to have clinicians see that the epilepsies are rarely seizures on their own, that they have other delightful things along with them, and that needs to be addressed as a whole almost.
Yes.
But thank you for being with us today. Everyone, rest assured that Abril will be with us again over the next year, because we went through so many topics we had to discuss and we just couldn't talk about them all.
A lot.
Yeah. And I guess please everybody realise that it's good to talk about sex with your clinician, and to talk about it with to talk about it with your patients, whichever angle you're coming at things from. We are all animals, and it's something I think that's part of our health.
Yes, thank you very much, Torie, for inviting me to your channel, to your podcast. It's really nice for me being here in South America, very low in the world.
Depends the angle you're looking at things from.
Yes. Thank you very much. For me, it's really nice to be here, and the message is talk with your patients, that you will learn a lot also.
Thank you, Abril, for your absolute passion in helping to improve a person's quality of life. After all, a person with an epilepsy is far more than solely their diagnosis.